Okay. Go ahead.
Hi, here are represented some of the staff, the physician staff here at Memorial Hospital, Carbon County. We're going to go around and introduce ourselves, starting with Dr. Cunningham.
Hi, Dr. Cunningham. I'm the OBGYN here.
And I'm Dr. Ed Zimmerman. I'm one of the ER docs here. I'm also the public health officer in a different county.
Dr. Abels, ER, mostly clinic now.
Dr. Greg Johnson, emergency department.
I'm Dr. Stephanie Chu. I'm the medical director for the clinic and the chief hospitalist for our hospitalist program.
So we're here to give you a little bit of information on COVID-19, the coronavirus, and our testing we're doing here at the hospital, and then we'll have one up to questions that you guys can send in. As of this morning, we have 56 cases in Wyoming. That'll continue to blossom because we now have ability to test, and we couldn't previously. Many counties, including my home county, we had no testing material for quite some time, and so we had probably had some cases we weren't able to catch, and therefore we couldn't isolate people the way we wanted to and keep them from having contacts. And so that's one of the reasons that the governor put out these state orders as far as being 6 feet away, closing down the gyms, making restaurants down, drive-through, dine out type stuff. And so that's been helpful as far as social distancing. This virus is spread similar to the flu, it's just more contagious. So everyone with the flu might spread it to 1 or 2 other people. People with this coronavirus will probably spread it to 3 or 4 other people. So it's twice as bad as the flu. So when you hear people saying it's just the flu, it's not just the flu. And that's the big point we want to make is I don't want people to minimize this as not being that dangerous. The death rates are high in some countries. In the United States, it's around 0.2% right now, very low, similar to the flu. Except if you are 80 years or older, and then the numbers are atrocious. If you're 80 and over and you get this virus, 1 in 5 will die despite whatever we do. We can give them the best medical care, we can put them on the ventilator, still 1 in 5 will die. And we've never dealt with a virus that has been this fatal and sparing the young. Rarely we see a hospitalization, and I can't find any deaths for children for COVID-19, but certainly the elderly have been hit very hard, especially when you see the news from Italy. They are a very old population, real heavy smokers, and it is going through there like a wildfire. So that's where we are. Social distancing is the only thing we can do to prevent this because it's spread by droplets, and so when people are coughing or sneezing, if you're at least 6 feet away, chances are those droplets won't get on you. 8 or more would even be better, but now we say 6 feet. And that distancing and staying away from people, you just have to assume, pretend like you have the virus and you're trying to keep everyone else from getting it, as opposed to thinking that they have the virus and you're trying not to get it. So that's my intro, and if we have questions, we'll be glad to take them. We're still testing here at the hospital. We have test kits. If you meet criteria of having the fever or the travel or the dry cough and they're evaluated when they come in here, and you meet the criteria that we've already set, then you may get the COVID testing that we were not doing as aggressively previously because we didn't have the material to do it with. We now have the test material. We can test if we feel that you meet the criteria to have the disease.
We actually only have 40 test kits total at this time. So the testing will be done when you meet the criteria, but also we have to depend on the clinical judgment of the ER doctor, the clinic doctors, the OB doctor, to decide, is this test going to be necessary to help treat you? If we suspect you have it, home isolation will be strongly recommended, and you must adhere to it to protect your family, other people.
I've been reading some of the newer articles that are coming out, and like Dr. Zimmerman was saying, this is much worse than the flu. The articles that I've been reading have been describing it as a pneumonia pandemic, not so much just a viral or a respiratory infection pandemic, but an actual pneumonia pandemic, which puts it in a little bit more perspective, I think, and I think really describes the gravity of the situation. It's not just a cold.
And it's spread by droplets, cough, and everything else. When I go to the grocery store, I wash my hands before I go to the grocery store, wipe down the cart, wash my hands immediately when I go home, just because people are touching things in this grocery store. We have to get the groceries, but you got to protect yourself with hand washing, 20 seconds, soap and water. if nothing else, use the alcohol, but soap and water is much more kill agent than the alcohol sanitizers.
And the virus could last on plastics. You think of people who've touched it up at the grocery store and picked it up and put it back down, they touched their face, and they've spread it to that. We know that at minimum of 4 hours on plastic, and there's a big range depending on the plastic and temperatures and stuff, but the next person who picked that up, if you picked it up, you could very well have gotten the virus, you touched your own face, and then you're infected. So that's why where you want the good hand hygiene, don't touch your face, wash your hands a lot, and try to prevent spread.
And paying attention, touching my face while I'm at the store, I found out I touch my face like most people more often than I ever thought. But I do not touch my face in the store.
One frustrating thing for a lot of people is hearing on the news that everybody has the right and can be tested. You know, that was not realistic. Despite that being a goal, the equipment is not available across the nation. There was an article in New York Times a week and a half ago or so addressing that. So don't feel like we're alone in not having the necessary supplies. It's a nationwide issue. Another thing, a lot of people know that with influenza, that it's necessary to get medical care within the first 48 hours because Tamiflu, the medication to counteract influenza, is only effective within 48 hours of onset of symptoms. What you see in the news about hydroxychloroquine, chloroquine, azithromycin, even though that's being studied, that's not something that's being used for routine cases. That is reserved for people hospitalized on ventilators. Recommendations might change going forward, but based on what you see on the news, that's not something that is recommended to use for routine outpatient cases.
And it is not recommended for prophylaxis, which is prevention of the disease either. And that's, people are buying that thinking that, and trying to use it, thinking that will prevent them from getting it. There is no indication that that does anything for that.
Also, if you come to the ER, as this pandemic grows and we start seeing more cases here in the county, and we will, and we do see COVID positive patients here in the ER and in our hospital, we want everyone to use good judgment of who comes to the hospital and who tries to use the clinic. If this is a chronic problem, or you've got a sinus infection or ear infection or chronic back pain, we see a lot of visits that maybe aren't that acutely needed in the ER, and you're putting yourself at risk by coming to the ER sometimes. And so if you're ill, we certainly want to see you, but we want everyone to use good judgment also, because even by coming into you're going to make a little bit of risk to yourself, because other people coming through are also going to be possibly having the virus also. It's hard to do social distancing in a situation like that. We screen people at the door, and we'll continue to do that, and that's how we try to keep patients safe, is we screen at the door and we actually isolate people that might be infected with the virus. We actually take them to a completely separate area. And so we'll continue to do that, trying to keep people safe that have to come in for other reasons.
And along those lines, so for the clinic, it's a similar situation where we're closing down the clinic to any chronic problems, so in terms of high blood pressure, things like that. We are setting up telephone visits. We've conducted some of those in addition to telehealth visits. We also are asking our patients, because we're not sure how long this will last, that they get, equipment like a blood pressure cuff at home. If they have, they're oxygen dependent, getting a pulse oximeter so they can measure how much oxygen, they're truly needing, how they're saturating on it. The biggest thing is, like Dr. Zimmerman mentioned, it's not just somebody who's coughing and who's obviously sick that would be possible to expose you. People can also be asymptomatic and expose you. So that's why we're limiting as much as we can the interactions we have even between our own patients. And then that way we can help social distance even in the hospital, even in the clinic, and that'll help minimize the spread of this virus.
Another frustrating thing, or something that people aren't used to, is limiting visitation in the hospital. Everybody that comes to the hospital has to be screened with their temperature. Employees are being monitored as well. And part of the social distancing is minimizing visitation in the ER as well as to inpatients. We realize that that's a frustrating situation for patients and family members, but it's definitely necessary under the circumstances. Likewise, at other times, family members of employees that might come and visit them or bring them food or something when this pandemic isn't going on, they're not allowed to do that as well. So it's not just the patients that's being affected, all of the staff are affected as well.
And just to piggyback on their points, the women's clinic is also rescheduling or pushing out well-woman visits, non-emergent visits as well, for similar reasons. I'll be talking with Dr. Macy and some others today about potentially doing less in-person OB visits actually as well. There are recommendations coming out from groups of maternal fetal experts to space those out, only hit kind of the big visits like an early ultrasound, the dating ultrasound, and then get a little more visits in as we get closer to the end. So we may be doing less inpatient OB visits in the very near future. As far as visitors go, currently we're allowing one labor support person during labor. There are places such as certain hospitals in New York who've actually had to cut that out and do no visitors in, even when a patient is in labor. We're not to that point yet. I can't say that we won't get to that point, but we're not there yet. But that just drives home the severity of this pandemic, that some hospitals have had to go so far as to say no visitors even for labor. You know, the father or the whoever would be the support person has to be on Skype or FaceTime or something like that. So those are some of the changes you might be seeing in the women's clinic. As far as pregnancy in general with COVID-19, there are a lot of unknowns. We don't have tons of data yet. We're still early. You know, this will be filling the medical journals for the next 5 years probably. We'll be looking back at this. Right now there's not a lot of data. You know, the biggest case series I've seen so far only had about 40 patients who were pregnant in it. There may be a slightly increased risk of miscarriage, preterm birth, those sorts of things. But when you're dealing with such low numbers, it's hard to know if that's real. Some of those problems just had one patient that had that complication. So 1 out of 41 is a couple percent. And so that looks high, but it's just one patient. So is that real or not? It's hard to know until we get thousands of patients and have better data. For the most part, pregnant women have made out really as well as anyone with this disease, mostly because of their age. Most pregnant women are younger, relatively speaking. And so we don't see, as of yet, we don't see transmission from mom directly to baby. So that's something that you can be pretty reassured about. We haven't seen that yet. And so there's still lots of unknowns in pregnancy, but so far nothing to be overly concerned or overly worried about in pregnancy. Obviously we we are concerned about you, and we will be keeping a close eye on the literature and a close eye on you. You know, pregnant women historically are impacted a little bit more by respiratory viruses such as influenza, so we're cognizant and we're watching the coronavirus in pregnant women, but so far it hasn't been as bad as we might expect. So. Oh, breastfeeding, that's a good point. There are kind of some mixed recommendations out there on breastfeeding. The coronavirus has not been found in breast milk yet, so that's good. The potential issue would be transmission from mom to the baby. What CDC is saying, and probably the safest thing to do, would be for the mom to use a breast pump, and have a healthy family member feed with a bottle. That would be the safest thing to do. If that is just not possible or not something that could happen, the mother should wear a face mask, and of course wash her hands before and after, and actually wash the breast as well. In addition to sanitizing the pump and all of the parts according to what the manufacturer recommends with each pump.
Even though the hospitalization rate on this is not very high, I mean, if we look at the, maybe 8% of the population will get it, so it's not like everyone's going to get this virus. The percentage that does, we have a hospitalization rate anywhere from 6 to 14%, depending on the countries. Out of that, maybe 4% of that will require mechanical ventilation. So the numbers are kind of in your favor that it won't go that route. But once again, it's skewed so heavily towards those over age 60. So children, they get it. Women never even knew they had it. But the elderly, for certain. And so we're trying to protect the elderly by ourselves being very careful about who we're around, because these are the people that we do not want to catch this disease.
Dr. Zimmerman, along with that, right now we have a question. How many patients with the coronavirus do we currently have in the hospital?
We have no patients with coronavirus in the hospital.
Thank you.
And we have not had any patients in the hospital with coronavirus.
And we've had 3 positive tests ascribed to Carbon County, but the one person that got sick is currently out of state, but it counts toward their place of residence. So we actually only have 2 citizens that we have found so far in this county.
And that person who was out of state, they were diagnosed out of state and never came back into the state, but because they're a resident of our county, that's why it counts towards us.
Which doesn't make any sense, but that's how they count the numbers. And that's the way it spreads and how it's more infectious than influenza. That's why we have to suffer through this social distancing, and also really you all should stay at home as much as possible unless you have to go to work, you got things to do. We understand that. And then when you do go to these places, make sure you try to protect yourself and everybody else around you. I haven't shook anybody's hand now for weeks. So simple things like that.
No hugs.
No hugs.
Okay, it looks like we do have another question here. If you suspect you may have had the virus, how long are you contagious? Secondly, are there certain symptoms that should be completely gone?
And so I think the newest CDC recommendation is that if you are sick, that you need to self-isolate until 3 criteria are met. So number 1, it has to be at least 7 days from when your symptoms first started. You have to have at least not had a fever for 72 hours. That includes so not using Tylenol or ibuprofen and not having a fever, and then also your symptoms need to be improving. So all 3 of those criteria need to be met before you're able to take yourself, or before you should not be in self-isolation.
Is a doctor's note required before you return to work?
For for a lot of places, they are requiring a doctor's note. So we're having a system set up. We have it in the hospital where either if you're triaged by the phone line, that they'll say how long you need to be outside of the outside of work for, out of work, or if you're seen in the clinic for a follow-up. But generally what we recommend is that you call ahead to see, because if it's something where we can triage you over the phone versus, if you come in and you're potentially still infectious, or if somebody else comes in and, you're exposing yourself to someone who doesn't know that they're sick. So that's why we're trying to still limit the contact, and so we do have that triage phone line for the hospital.
Perfect, thank you.
And you have a practitioner in the clinic that sees people for return to work then?
Yes, so all of them see patients for return to work, and then we have one designated per day who evaluates the patients who screen positive, who might require coronavirus testing.
Okay, thank you. We have another question. As a child care center, what would you recommend us to do other than wash hands often and continue bleaching everything, which does include toys and walls? Any other recommendations there for child care centers?
If I can address that, because that word came out, and I've dealt with some child care centers, okay, quite a few of them recently. Obviously, you're limited on the kids you're going to have. Most of these daycare centers aren't full because we've limited the essential personnel, so they're all going to have kids that belong to the people from healthcare or the EMS or something like that. And so the number of kids is down, which helps. And then once again, we're actually requesting that they try to keep some isolation even between the kids, and so they keep the kids spread out. At least the 6 feet the best you can. For little kids, we understand that's not always possible. And then everything they touch has to be wiped down as often as you can. The one daycare I visited, they had one person just walking around wiping everything down. And then she literally did that all day. From the time they got there to the time they went home, she was wiping down hard surfaces the entire time. So everything has to be cleaned. You have to try to keep the kids away from each other. And then especially when parents are picking them up, make sure that the parents are not sick when they're coming in. You don't want the coughing, sneezing parent coming in to take care of kids. It's going to expose the other children. And so you have to be a little careful on how the pickup goes. Make sure there's no one else around when they come to pick up just their child.
All right. So for many of us, it's also the start of allergy season. Can you talk about the difference in symptoms?
So generally with allergies, so you will get the runny nose, the sneezing. However, you typically also see itchy eyes too with that, and your nose gets pretty itchy. However, it's not always 100%. So it's something that if you at all have any doubts, I would just self-isolate, or you can always call our line. Really, in the end, isolation, I know that it's not convenient, and it can also definitely be very difficult to not get to see your friends, not get to eat dinner with people, not get together. But really, if you have any doubts at all, it's always better to be safe than sorry. Another thing is, if you've never had allergies in your entire life, and all of a sudden this year you start having allergies, that's probably a little bit less likely to be allergies. But if you're somebody who every single year gets these exact same symptoms, and itchy nose, runny nose, itchy eyes, sneezing, then it might be a little bit more likely that you have allergies. Allergies, though, you should never get a fever, so that's something that if you're getting a fever, that definitely is a lot more worrisome that you're acutely sick versus having allergies.
And statistically, the most common thing is a dry cough. If you're coughing up a lot of phlegm, it's not as much coronavirus appearing. So 86% of people that are presenting have the dry cough. That's one of our big screening material. We still use fever also, but only 60% of people have a fever when they first show up. Often they'll get that if they end up being hospitalized, otherwise not. But the fever and the dry cough are the two biggest criteria. And then, of course, exposure. If you've been someplace where it's kind of a hot area where there's active cases, that puts you at increased risk. Sore throat, occasional, not much. Nasal congestion, not really. This is a lower respiratory lung thing. You don't really see a lot of, if you have a really bad sore throat, it's probably not coronavirus.
Okay, thank you. When Dr. Abels mentioned the number of test kits in-house, are hospitals only allotted a certain amount by population and risk factors?
That is, the state has gotten X number of kits because the Wyoming Department of Health got these kits, basically. The feds did not send many kits to us, in spite of what was put on TV. And the allotment is based on population and where they think hot spots are in the state. And that's how nationwide a lot of these kits are distributed. Like New York got a lot more kits than we did. for a population, but that's a hot zone, very hot zone. There now, New Orleans is heating up, so they'll be shipping more kits that direction.
This is a minor success story. This is Wyoming taking care of itself.
Yeah.
The test kits we're using did not come from the government, because as soon as this started happening, everyone got online, every provider, and ordered all the test kits they could. And then when the rest of us tried to order, there were none available. And so, the county that I'm a public health officer for, we were down to 11 at one time for the entire county. And so we're being very careful who we tested. These tests we have now were developed by the state lab. So this was Wyoming's taking care of other Wyomings, because this was not done by the federal government. We would not have these if we had to wait for them at this point.
Yes. And when we first got wind of this starting, this hospital did order extra kits in prior to this, but then when we tried to order a next round of kits, there was none to be had, unfortunately.
Okay, thank you. How is the hospital's blood supply faring? Is there a need for blood donation as the national supply is depleting?
The blood supply in the hospital we got is down 1 or 2 units, so we're doing good compared to most small hospitals. Because we live on the interstate, we've always been allotted more than some of the other small hospitals. But blood donation is critical at this point in time. And I've been trying to find a place to donate myself. And do we have any information about any blood donation sites coming up? Anybody?
No, but we can reach out to our contact in Casper and Cheyenne, and that is something that we can certainly coordinate with them to offer that service here locally.
And the local public health officer will have to okay it. They have to submit a plan on how they're going to do it to keep everybody socially distanced. In my county, we're going to have a blood drive, and we will already just okay their plan of how they're going to keep people separated. So it's doable.
And
Who's our public health officer for the county?
Dr. Couch is our public health officer.
Oh.
So, Dr. Couch is our current public health officer in the county, and also questions can always be related to public health. I know in my county we're really busy with lots of meetings and lots of phone calls and radio interviews, and so I'm sure public health here is busy. You can certainly address questions to them also.
Okay, perfect. Okay, we have another question. I have seen a lot of different reports on the use of ibuprofen as a fever-reducing agent with the coronavirus. What is this panel's stance on the use of ibuprofen?
the ibuprofen question basically came up on a very tiny study that was not validated. And validated studies are important to doctors, by the way. And it was basically inconclusive. We don't know. So if people are concerned, if you have a fever or discomfort, then you should consider acetaminophen, Tylenol. Would the panel agree with that?
Yeah, I would tell the patients the same thing. If Tylenol works, great, use it first.
But I'm still using my anti-inflammatory because Tylenol doesn't work for my joint pain. So.
Okay. What are the current statistics showing as far as the accuracy of testing? I recently read an article by a doctor stating that they are seeing a 25% inaccuracy. Can you speak to that?
That is correct. And that's the reason that the FDA just approved a new test that the accuracy is better, but it has not been manufactured and distributed yet because it was just approved this last week. And then there's two other tests that's in the works. That one is about 92% accuracy. Now that doesn't seem like a lot to people out there, but 92% accuracy for medical tests is actually high.
Okay.
Does that help that question?
I believe so, thank you. How many ventilators does the hospital have currently?
I think it was, 5 or 6, I believe, and then we had one.
We have 5.
Five, okay.
5, I think.
We had one CPAP machine though that could be used as a ventilator if needed, but not in ideal situations.
And we
do
have
that.
And we have 5 ventilators. We also have other modalities to help patients breathe, like CPAP and BiPAP modalities in this hospital too.
And Vapotherm, if you've heard of that one.
Vapotherm, yes.
Vapotherm's been very effective for this, as in a lot of people are being kept off the ventilators with Vapotherm. We only have one here, but it's still useful.
But we still we have 2.
Two Vapotherm, so we have other ways we can help.
Yeah, so we have other things. And what And the whole point of isolation, social distancing, trying not to spread this virus, even though we know it's going to spread, is not to have a surge like they have in New York. Think of New York. Suddenly they're short 30,000 ventilators. That's because they had a surge. We are trying to prevent a surge, but only the public can prevent the surge. We cannot.
Okay, so tying into that, we have another question. Do you, the folks on the front lines, have any ideas how we can get people to take social distancing more seriously? I am talking about the folks who are taking their entire family into city market, etc., or the people who feel it is necessary to continue to have their organization meetings or who continue to visit one another at their homes. Maybe this isn't the right place to ask, but any help is appreciated.
It is exactly the right place to ask, because this is what, when I went to get a loaf of bread, I walked within 5 feet of somebody and they said, "You're within 6 feet of me," and I said, "Thank you." Mm-hmm. So basically, we all have to be very direct with this and talk to people. And I'm not much I don't do any Facebook or social media until this, and but encourage your friends, spread it out on people. Social pressure is how we get this done. Unless you guys disagree.
Yeah. We all have to police ourselves. So I mean, even within the hospital, if I find somebody who's not wearing their PPE correctly, I say, hey, actually you need to wear goggles with that. And I tell them it's because, we care about you. We want to make sure you're not getting sick. We want to make sure that, you don't end up in the hospital on a ventilator. It's because we're caring about everybody that, we want to make sure that everyone minimizes their risks. And we all, unfortunately, just have to give up certain of our liberties that we have right now. So for instance, I just had a newborn baby. They have not seen my parents for 2 months. They haven't seen their grandparents for 2 months, because of the fact that they live in Colorado and I'm not traveling down there. So even though it's something that is not ideal, we do FaceTime, we do, Skype, Zoom, things like that. That's one of the big things too, is Skype and Zoom. They're free, and so those are things that, you can still have that interaction with people instead of just on the phone. But really, it's just we're going to have to give up certain of our comforts that we have, that we've enjoyed in the past. If we can all do that for a short time, it'll make it a lot shorter of a time versus if half of us do it, for a short time, it's going to extend the course where all of us then need to do these measures, and then that's going to be a lot harder to maintain versus if we can just kind of bunker down for at least, several weeks and really make sure that we're adhering strictly to our social distancing rules.
And it'll be shocking for Wyoming, but the restrictions can't get worse. And at individual counties, if we see widespread social spread of this disease in a county, they will lock the county down. It will be, you cannot leave your property. It's already like that in New York. They've done it in California. It can happen here, and it may not be the whole state because we're pretty spread out. But individual counties, if we see in the spread within the community, it looks like community spread. Public health officers can shut down that county to where you cannot leave your property, and that's where you'll be, except for doctor's visits and the grocery store, pretty much. And so I don't think anyone wants to go that extreme. So if people would just do some social distancing now, we can avoid more extreme measures that might be necessary later.
Just like with some teenagers that I was talking to, they asked me a couple of questions. Well, I should just get the virus, and I'm not going to die, and I'll be immune. And then I carefully explained to them, what about your grandmother, your grandfather? What about your father and your mother? They're at higher risk. Oh, simple discussion. And they said, we will not do that. We will do the social distancing now.
And we still have children on ventilators, we still have a 14-year-old who died in Los Angeles. I mean, it's not something that, young people are invincible. So even if it's something where you say, oh, I don't come in contact with any elderly, I mean, you're still at risk too. So, just kind of for yourself and also your loved ones, it'll just be really important.
Okay. Have any of the positive cases locally or in Wyoming resulted in hospitalization?
Not in this county.
Not in this county.
In other counties, yes.
Okay. If you suspect you have the virus but have recovered, how susceptible are you to getting it again?
We don't know, but the last 3 things on EMRAP and MedCram, these are educational sites, basically feel that reinfection is not happening at this point in time.
I know there was a report out of one patient out of China, but that's
Yeah.
not
And-
much.
And that one patient out of China showed it was fault, when they actually looked at the testing graph, showed it was a faulty test.
So just like influenza, which is a seasonal recurrent infection, there's always the possibility of viruses like this mutating and having different subsets of virus. With other infectious diseases, oftentimes if you're exposed, you'll have antibodies that protect you in regard to reinfection. With influenza that has innumerable subclasses, that's not the case. And people need to keep in mind that, this is new to us, the medical community, so thinking about reinfection, this virus has only been problematic since December of 2019. So we do not have the data going forward to give concrete answers in regard to reinfection and such.
And one of the things that's also unique about coronavirus, so there are 4 typical strains that cause common cold, obviously different from what we're seeing now because those are, not as life-threatening. Usually people don't have as high of a chance of dying from it. However, with those other strains, people who even have been introduced to those strains before, for some reason, compared to other diseases, like Dr. Johnson was saying, where, if you get exposed to a certain bacteria and then you have antibodies to that, this one, though, even people who have been exposed and who have antibodies to it, they can still get sick again. They did a study where they inoculated a bunch of people, which means they introduced in purposely the virus of a common cold for people who already had antibodies, and they still got sick from it. So it's very possible, too, that it could be something that even with the exact same strain, in another year, you can still get sick from it, even though you were exposed and had healed from it already.
Yeah, because the antibodies are not long lasting with coronavirus, so reinfection can occur next year. If this becomes a seasonal disease, reinfection can occur. But there is also the fact that pediatric patients are less affected by this virus than influenza virus, because this virus has a specific little attachment that doesn't mutate, and that's what our antibodies are formed against it, as far as I could read. Now, all this is preliminary stuff that I'm reading, and everything I say now could be wrong 2 weeks from now, so sorry.
Okay, so we have a question regarding the nursing panel that we most recently held. Can you clarify the nursing panel statements regarding asymptomatic patients that do not drive the disease? Those with symptoms do drive the disease, if we can get sick from asymptomatic patients.
Yes.
Yes, you can get sick from it.
So if they're asymptomatic and they touch their mouth or their face and they touch plastic, then they've transmitted that virus. So asymptomatic carriers are still spreading the disease.
And in fact, these outbreaks, because we've not been able to screen like we should have from the beginning in this country, that a lot of the initial bursts and surge probably came from asymptomatic patients, unfortunately. Would you agree?
Yes, and we weren't able to test. Even like I was in my county, we couldn't even test for a bit. So.
Okay.
A similar situation that most people in the medical community are aware of. Say with strep throat, there are asymptomatic carriers of strep, and they are infectious to family members and other close contacts. So I think similarly with this, the assumption that people can be asymptomatic carriers.
Okay, so for those that have been tested and tests ran by the state lab, was a rapid biofire test ran? I understand that this tests for 22 different illnesses.
No. There's very few facilities have that. That's the viral panel. Most people don't have it. It's a really expensive test. The big hospitals have it. I think Wyoming Medical Center even has it. And so the ones that were tested there in the hospital probably got it. But for those of us in the community, we did not run that test.
And even a lot of big hospitals don't have that in the country. When I read the article on that test also.
And some of it is because it's a little bit moot. So the thing is, you can still have a virus and have a bacterial pneumonia. You can still have a different virus and also have coronavirus. So that's why we generally don't do it, because even if we have it and we say, oh, look, there's definitely this other virus, we can't say with 100% certainty, you only have this, that's the only thing that's going on with you. So that's why we tend to not do it. It gives you a false sense of reassurance that, whew, you know, there's no way I could have anything else, but that's not true.
Okay, so we have a sort of a long question here, and I'll do my best to pronounce the names of these medications. What is this panel's stance on the use of hydroxychloroquine, the anti-malaria drug, and azithromycin to potentially treat COVID-19? If there happen to be cases that present to this hospital, would that be a possibility despite it being in trial stages?
Well, I think Dr. Chu and Dr. Johnson kind of answered that. We have a very limited supply for very sick patients, and we are going to follow the compassionate care guidelines for if a patient is really, really ill and it may save his or her life, we will use everything that we can. Would that be accurate, Dr.
Yeah, so people that are hospitalized on ventilators, so that's a different situation than somebody coming in and feeling terrible, feeling very sick with all of the symptoms that we associate with it, but their oxygen saturation is fine. Just like with, once again, not equating this to influenza, but some of the symptoms with influenza and other viruses, people know how terrible you can feel. That doesn't put you in a category that we would necessarily treat with the hydroxychloroquine and azithromycin. That's typically right now, and any of the panel can correct me if I'm wrong, for people that are hospitalized on ventilators in a life-threatening situation, not outpatient people that feel terrible.
And another reason that we have to be careful is after the news articles came out, most pharmacies ran out of 2 medications in this country.
Okay, so as a follow-up to that, what is your opinion on using antibodies of recovered patients in patients who are newly diagnosed?
Yeah, it's kind of beyond the capabilities for anyone here.
Yeah.
That's beyond anything that would be done around here. So.
Those studies are ongoing.
And those studies are ongoing. There is no data yet, so we don't know. Sorry.
Well, once again, this only came into existence as far as a human infection in December of 2019. So keeping that in mind as far as long-term studies, that's where I think Dr. Zimmerman mentioned that we'll be reading about this for the next 5 years. And that's very true. There will be a lot of research and studies looking back at the epidemiology of the whole situation, but it's much too new of a disease in humans for us to, for anybody to have those answers.
And like the medications you guys asked about, like the hydrochloroquine and the Zithromax, those studies were actually done on the SARS-2, 2002 epidemic. They did these studies and showed some of these effects. And that's why we picked these things up to try them again. So that's how things work in human biology.
Okay, do you think the increase in cases this week from around 20 to almost 60 is due to better testing or more actual cases and the illness is truly spreading?
I think both.
I think both. Yeah, obviously testing is a big deal because we were being really tight with our test kits for a while.
Yeah.
Now that we're testing more, I'm sure we'll pick up more. But it was in the community, and we knew it was spreading. We're just able to show it now.
Yeah.
I think if they got an accurate test that was distributed nationwide, the statistics would be mind-boggling as far as the numbers going up tremendously just because more people would be tested.
I think the estimation is that for every person who's confirmed coronavirus, coronavirus, that it's about 10 times as many people who are asymptomatic who actually have it, or have symptoms but have not been confirmed. So the actual number we have is much higher than our confirmed cases.
Yeah. So if we get increased testing, you're going to see the numbers climb dramatically.
And the reason that we are interested in increased testing, even though it's not going to help the individual patient, it'll give us a better handle on how to try to prepare as best as possible in each and every hospital for the anticipated surge.
And when someone's been told they're certainly positive, it's much easier to track down people they've been exposed to and test them so they can self-isolate. People are more apt to isolate if they have a confirmed test. Telling people to self-isolate is variable.
So when you read initial statistics, and it was changing every day about the death rate associated with the virus. Well, if you're only testing patients initially that are in the hospital and on ventilators, you're going to get much different results as far as the death rate associated with this virus, as opposed to testing, widespread testing in the community. Back in 2009, when we had the H1N1 strain of influenza, where they developed a second vaccine that season, the initial reports with that were a very high death rate associated with that. And as things panned out, it certainly did not substantiate that. But once again, that's what we'll be reading about over the next several years, looking back at all the data to see the incidence of the disease, and once again looking at the different age categories, and get a better idea of the death rates associated with the infection.
And that's why the total death rate for the nation now has dropped substantially from the initial numbers from Washington, because the denominator got much bigger.
Okay.
Mathematics.
I've seen some articles regarding positive results on the use of vitamin C to treat COVID-19. What is the likelihood of this simple treatment being effective? Any thoughts on that?
I'm sorry.
I'm a believer in vitamin C for common colds and such, and I take a little extra vitamin C when I start feeling like I'm coming down with something. Can I actually substantiate it with what we call double-blind studies and such? No. Another thing that came out with the initial hydroxychloroquine one, some of those studies was the use of zinc, and same thing. I can't comment on the effectiveness.
Well, I can comment on the zinc. Zinc is not effective. The medication itself brings your own zinc in. Unless you're depleted of zinc, it has no effect. Yeah, I can tell you that zinc doesn't.
So like the zinc tablets that people buy for common cold and that kind of thing. There's nothing to substantiate that that's protective or beneficial.
And there's actually a study with, once again, the SARS-1, which is a similar virus, that giving extra zinc did nothing. So.
And actually the nasal zinc, you can get permanent loss of smell too.
Oh, really?
Yes, so it's something that, it's not just a benign treatment, so definitely take that very carefully.
If you take the zinc, take the pill.
Yeah.
And someone's going to ask about the loss of smell. That has been shown that the early loss of smell may be the earliest sign of coronavirus infection.
Especially in young patients that are tending to be asymptomatic otherwise.
So don't do the zinc, lose your sense of smell, and then be worried you have coronavirus. Right. Just don't do that, and then that way we'll be able to just tell without any of the zinc if you've lost your sense of smell, which with that comes sense of taste too.
So if your kids don't like your cooking now, and they used to,
or the reverse.
Yeah, right.
Okay, is it true that someone with severe asthma is more prone to get this virus?
I think they're more prone to have complications. I don't know that getting it in the first place has any effect on the asthma, but certainly if you already have an underlying respiratory condition, the risk of getting the pneumonia with it is much higher.
And that goes for, well, any respiratory infection, excluding the coronavirus. We worry about asthmatics more with influenza, with common colds, with allergies. They're just having the underlying asthma that puts them in a little different categories as far as complications.
And in any asthma patient, the highest trigger tends to be any viral infection.
Mm-hmm.
Okay, so going back to the vitamin C question, if there are people interested in using that, are there any precautions people need to consider prior to using it, and what about the dosage that you could recommend for vitamin C?
There's not great dosing information for that. If you're taking vitamin C and develop loose stools, that means that you've kind of reached your maximum dose. I mean, that's the most information I can give as far as proper dosing of vitamin C.
So just say
There's a
500
standard dose of
Was it?
500, right?
500 is the
500, yeah.
over-the-counter capsule.
So
But
500
I mean,
would be
I have some, 1,000 milligram capsules and that kind of thing, but, I mean, if you looked up, absolute ideal dose, I don't think there is one.
not that I'm aware of.
Yeah, the good news is it's water soluble compared to fat soluble, so even if you have too much, well, I mean, besides the diarrhea, you'll pee out most of it. However, some of the fat soluble ones, like vitamin D,
Yeah, be careful.
the problem with that is because it gets absorbed into your fat, which is a lot harder to get rid of, and that's why those are a lot more dangerous to take too much of versus the water soluble ones like vitamin C.
So vitamin A, D, E, and K, those are the ones that you can actually become toxic by taking too much. The other ones your body eliminates through the urinary defecation.
Okay. So we have a question about attending Mardi Gras in New Orleans.
Don't do it.
Don't do it.
How long should you be concerned that you may have been infected, even though you feel great at this time?
The usual incubation period of this disease is 3 to 5 days. It's seen at 14 days, rare at 21 days, I think.
I think
Current data.
the standard consideration still is being careful for 14 days post known exposure or anticipated exposure.
Okay, so we are getting close to wrapping up our time today for our panel discussion. Are there any other questions out there, or is there anything else that the panel would like to state at this time as we prepare to wrap up?
Thank you for your interest. Help us.
And then there were two things. One I forgot to speak to is that we are doing well child checks on Saturdays, because once again we want to minimize the time that our well children are exposed, but honestly, because without immunizations, their chance of having a bad outcome or even death from any of those preventable diseases through vaccines is higher than coronavirus. So we definitely want to keep with their immunizations to help protect them against those preventable diseases. And then anyone who can't make Saturdays, we're doing case-by-case special accommodations, so they're not in the clinic at the same time when everybody else is sick. And then just one thing to really emphasize the whole asymptomatic, so when someone has no symptoms and can be contagious. So there was a doctor in Italy who swabbed everybody in his town, and of the people who tested positive for coronavirus, only 1/4 of them, so 25%, had any symptoms whatsoever. So there are a lot of people who have it who have no idea, and that's just why if we can emphasize the whole social distancing, the limiting, those encounters, staying 6 feet away, that's why it's so important.
So with that, Dr. Chu, can you speak a little bit about the clinic specifically and the reason that we've selected specific days for the little ones and some of the precautions that the clinic is taking to clean and disinfect all of those areas as an extra precaution? Can you speak to that?
Yes, so because like the other doctors had mentioned how viruses can still live on, plastic, metal surfaces, so we don't want to have them in the same time that, somebody who has possible coronavirus walks into the doors and they're sick, and then your child walks in 5 minutes later. So the reason we pick Saturday is because we have somebody who's coming and doing what's called a terminal clean in medical terms. It means the whole clinic is totally cleaned down, every surface, And as a result, it's going to be the cleanest that the kids really can be at. At the same time, too, since there's no sick people that are in the clinic, even though when you're asymptomatic you can still spread it, it minimizes the risk that we're exposing kids to coronavirus. And that's why ideally Saturday is the best, but we understand some people only work Saturdays, you know, and they have to work, they can't come in. That's why for other ones we make special circumstance in terms of trying to see them on the OB department in the hospital, you know, for a well-child visit, or, you know, after hours when nobody else is there, and then we terminally clean those specific rooms and have our patients come in through a different entrance. So we're making a lot of arrangements because we want to make sure that our patients are taken care of first and foremost. We have many providers, almost all of them, who actually are coming in on Saturdays to staff this clinic, which, as you know, is not normal. They're offering to come in early, come in late, call patients. I mean, really, our clinic has banded together, our MAs, our front staff, our, you know, providers, because we want to make sure we give the community and our clinic patients the best care that we can.
Thank you. All right, so we do have just a couple other questions that have come in. For those who are wanting the most current, accurate, up-to-date information on current studies, local and statewide, what would this panel suggest for the general public to read?
That's a difficult one for studies because
Yeah,
all of them I am on our subscription services.
Yeah.
Most of them.
You have to pay for them.
No, we I think the
CDC
CDC guidelines, those are available to
And
the
one of
public.
Department of Health with
And
the
that's-
best information.
Yeah, so the CDC, we follow that. Whether some of it's decipherable to the general public, I guess that's, sometimes it'll
Can be
bring up more questions that non-medical people might not be able to interpret very well. But the majority of people can derive some information from that.
On the CDC site, there are different sections for healthcare providers and for patients. So going to the for patients links would be easier to digest. And I don't know if the Department of Health, Wyoming Department of Health
So
has
WDH, we don't have anything for studies on there, but we do have great information.
Yeah.
And obviously there's even a hotline. If you have questions, you can call for the Wyoming Department of Health. And it's very state specific, so if you really want to know what's going on with the state, that's the best website to go to. Some counties also have their own Facebook pages.
So as this whole thing has evolved, even information on CDC has changed and evolved quite a bit. I mean, so it's kind of an ongoing process as far as recommendations, ideal recommendations, as well as kind of what we're left with as far as equipment shortages and that kind of thing. So there's recommendations have evolved based on the reality of not having the ideal amount of personally protective equipment and such.
Some of the studies coming out from like New England Journal of Medicine or Journal of American Medical Association are not behind a paywall right now because of the pandemic and just specifically to coronavirus, but again, they can be kind of dense to go through and you have to be able to interpret them in the broader context. So there are some articles out there, but as far as guidance and official recommendations, CDC and Wyoming Department of Health are probably where you want to go for now.
Okay, and I would just add to that the hospital does have obviously a Facebook page and our website that we have a specific resource link regarding this virus, and so we're doing our very best to keep that information updated, although it, as was said before, does change very quickly some days. So, okay, with that, we're going to go ahead and wrap up today. I'd like to thank our panel, Dr. Abels, Dr. Chu, Dr. Johnson, Dr. Zimmerman, and Dr. Cunningham. Thank you for your time today. If there were questions that we ran out of time to address, I would encourage everybody to please go ahead and send those directly to the MHCC Facebook page, and we will be happy to address those. Thank you again for your time.